Rosemary, your opponents are arguing. You made the point that a retailer's bottom line is not society's bottom line. They're sort of saying actually those two things are not in conflict with each other necessarily. That in fact, when they're saying the incentives are aligned and that a CVS or any other provider at this scale would have absolutely every motive to have happy customers, happy consumers getting the healthcare they want, they need, and that in fact there isn't that conflict.
Well, I think the key is who can actually be a customer. It has to be somebody who has a way to pay for something. They have to have an ability to pay. And so whether that's they're coming out of their pocket or the employer that's covering their insurance, or they're on the Medicaid program and that's actually a government subsidy, somehow there has to be some money for the transaction. And there are a lot of people who don't have access to any of those things I just mentioned. And so they're shut out. So we don't have 100% customer base, and that's where retail's bottom line is not society.
But they've been making the argument that in fact it's people of lesser means who are able to take advantage of things like a Minute Clinic at a Walmart or a CVS. That they're not cut out. That they have more opportunity and choice than they would otherwise.
To some limited extent, but there are still people who simply can't even access that.
Greg Slager.
If they can't access that, they probably can't access other care facilities as well, too. So I think there is a better chance that they can access care in a retail environment, too. Because think about retail as well. I mean, the reason why they're lower cost is because they're subsidizing the bricks and mortar. They don't have these towers. They don't have these ivory towers full of doctors that get baked into the prices. They're, you know, the $4 generics or $4 for their employees or $40 visits. Those are rock bottom prices too. There's many more areas of the continuum of care that they are being cut out of currently in the way that the old model works.
And we talk about the ivory tower. What about the ivory ICU? I don't see Walmart having a $4 ICU or a $4 operating room.
Thank you. So the better point for me to make is actually that it's not just about the sniffles and the kind of low-hanging fruit, if you will, that a Minute Clinic can deal with. It's the more intensive needs that they're shut out of.
Yeah,
now,
Bridget.
I don't think we're arguing that you're going to go and get a triple coronary bypass in a Target dressing room. Nor are we arguing that government should completely abdicate its role. And Rosemary, with all due respect, the argument that employers are only covering half of America and therefore can't exert change on the system just doesn't hold water. Employers are the largest payer in the healthcare system. 151 million Americans compared to 50-some million Americans on Medicaid, 50-some million Americans on Medicare, 60-some million on Medicaid. Employers are the biggest payer in the system, and they're the business class passengers. They're paying the highest prices to these provider systems. Employers do have the ability to exert their power and finally start acting like the biggest purchasers in the system and get prices under control, and federal programs will benefit from that by having lower prices and a more responsible system where we contain runaway growth.
Well, that's really interesting, because why are they paying almost twice as much as Medicare for the exact same things? That actually suggests that government has got more of the power to influence prices, if you will, than the employers have shown to date, for as big as you say they are.
What it actually proves is that employers have worked not directly, but rather through intermediaries that keep them totally in the dark about pricing. And that's what these employer alliances are all about. It's about getting employers to work directly with the provider systems and finally exert their control. And that will drive down costs.
I mean, when you talk about employers exerting control, I am all for it. What your company does in partnering with large employers to exert more control is fantastic work. But when you get right down to it, large employers are only a third of all employed Americans. My family owns a John Deere dealership outside of Houston, Texas. My mother, who manages the benefits, doesn't have the time, bandwidth, or knowledge to not go through an intermediary to help them find good health care for their couple of dozen employees. Completely different game for the folks who work for small business.